Alex, we were able to testify together last week. Can you tell me a little bit more about what your experience was testifying with the House and a little bit more about your facility and what you're experiencing in Belton?
Yes, absolutely. So we're seeing an increase in our Medicaid patients, and one big concern that we have is the disparity between Medicare rates and Medicaid rates. Currently, the average daily rate for Medicare is $867 per day versus the Medicaid rate of around $530 per day.
So there's such a disparity in the rates between the Medicare and Medicaid. Is there any difference in the quality of the care that you provide to these different patients?
Absolutely not. No, our Medicare patients and Medicaid patients receive the same treatment. But an increase in these Medicaid rates to cover the disparity between Medicare and Medicaid would certainly allow for improvements in our facilities, improvements in our programming, and the quality of care that we're able to provide all patients.
So in addition to providing inpatient care, it sounds like your facility also provides PHP and IOP. Can you tell me a little bit more about what that is and why it's so important for our patients?
Yes, absolutely. The PHP and IOP programs allow for the utilization of the full continuum of care for patients. So a patient that is stepping down from inpatient can do a partial hospitalization program and basically receive a high amount of therapy without having to be inpatient at our hospital, and then step down from there to an intensive outpatient program where they are able to begin to reintegrate more into their daily life but still receive a higher level of care than just individual one-on-one therapy.
I can speak a lot to the PHP and IOP level care. I actually used to be a therapist both in inpatient setting at Cedar Crest Hospital as well as PHP and IOP. And I found as a clinician that our children and adults just got so much more work done at this level of care. And it's so critical because the amount of therapy that they can get in a 6 to 8 week program would take over a year in a traditional outpatient space. But it's really unfortunate because this great quality program is not covered by Medicaid in the state of Texas. So we're really advocating for this to be an added benefit to our Medicaid products.
Absolutely, and the goal of treatment is less inpatient stays and certainly very few readmissions. So to bring this benefit for PHP and IOP would certainly reduce the readmission rates for those that are discharging from an inpatient stay back to the community.